kids, they would not wear helmets bike riding. I remember working at a rehab hospital with traumatic brain injury. It was my first job, and there were so many kids that were rollerblading. That's when rollerblading was big, and they would not wear helmets and hit the wall. So it's education. It's education. We were talking about diving, you know, proper diving, you know, taking lessons to learn. Because who would have thought that diving could cause these traumatic brain injuries or concussions? So it really is education. It's wearing the proper equipment. It is the body work. You know, I'm a firm believer. Ayelet's brother was only allowed to play high school football if he got treated every single week.
Yeah, he literally, and my mom actually is the developer of the body work that we practice, the integrated manual therapy. And her criteria at the time, if we played any sort of contact sports, was we had to do swim season, the alternate season. So whatever season swim team was, we couldn't do a contact sport in that season. So it was sort of recuperative, reparative, restorative. But then during the contact sport, we had to be in the clinic at least once a week to just get our joints aligned, so that when we were going into the sports, we weren't more prone for injury because our body was out of alignment.
And there's the spinning. I mean, my kids do gymnastics, so it's the double twisting this way, the double twisting this way, so the centrifugal force of the brain.
That's right.
And how do you have them train for that? I know with soccer, the reason why the girls versus the boys get more head injuries is because they're not as strong, so their head gets that,
like the bobble
the
effect.
bobble,
The
and the
bobble
boys
effect.
are stronger at a younger age, so then they end up having not as good. But with the spinning, I mean, I know it was a slow progression of learning these tricks, but they're doing on a regular basis. Double backs, double fronts, double twisting. It's a lot of spinning. So how do you...
I think, again, the hydration, if your brain, because most of us are dehydrated, so if you have that hydration, if you have the membranes fluffed up, I always use the phyllo dough, you know, again, you should have your dura free and mobile relative to the skull. You should have that fluid being able to cushion, all right? And then you have your pia. They should slide and glide. So with cranial, you're trying to perceive if there's any stuck downness, because you won't have that air pocket between the layers, giving it more padding. So again, I think prevention, optimizing the actual anatomy, the biomechanics, you know, making sure there's not tension through the optic nerve, because the optic nerve, which goes from the eyeball, you know, back to the sphenoid, back to the occipital lobe, making sure that there's not tension, or what we say tethering down, anchoring down, that those tissues are able to slide and glide.